Hi guys, I'm Tim, I'm an osteopath, and today we're going to talk about a condition that no one can actually say, but I'm going to say it for you: plantar fasciitis. That's heel pain, or arch pain, predominantly heel pain. And what we're going to do, we're going to talk about this condition, the presenting symptoms, and what you can do about it. So, presenting symptoms that most people go to their doctor, their physio, their osteopath or chiropractor about are heel pain. There's a few characteristics that are actually quite classic of plantar fasciitis, and that is pain after rest. So it's the activity that creates pain. So typically you're getting out of bed and that first few steps are giving you exquisite pain in your heel. It's almost like you've got a pebble or a stone in your shoe or in your sock, and it's really tender. Usually with plantar fasciitis, as you continue moving and during the day with activity, that pain will subside. However, if the activity increases too much, then of course the pain comes back. People also get pain in the arch of their foot, and that's the actual fascia, and we'll talk about that again in a bit more detail. So really, we've just covered the main key presenting symptoms that you will have, that you'll complain to your doctor or osteopath or whoever about. So let's look at this up close in a bit more detail. So looking up close at plantar fasciitis, which is also known as plantar fasciosis, heel spur, policeman's heel, what we need to do is look at the areas where the pain is and discomfort. These lines here represent the plantar fascia. So that's going to be tender all the way along there or in parts there. Usually most of the tenderness will be up here. And then we've got what looks like a smiley face, which is far from a smiley face if you suffer from this condition. So under here, this is the front of the heel. And as I palpate along here, typically this is where you'll feel like that stone or pebbles in your foot when you first tread on it. And then higher up, people often complain of tenderness, again, along this area. More to the inside, but definitely you can still feel it on the outside. And sometimes through the middle here. So any of these areas indicated in red or between here are going to be the areas that typically present with plantar fasciitis. This is our plantar fasciitis compression sock. And this is suitable for plantar fasciitis, plantar fasciosis, heel pain, and plantar fascia pain. It's made of a high-tech compression material which has graded compression zones, essentially providing the least compression where you don't require it and the most compression acting as an offloading support to the plantar fascia. By supporting and offloading the plantar fascia, what we create is pain relief both here, but also we're taking the pressure off of the attachment of the plantar fascia to the heel, and that's where you're getting a lot of the heel pain from as the tension is pulled through here. It's worn like a sock and is typically worn all day long. Some patients do wear it at night for additional pain relief. This is our plantar fasciitis support, and what we have here is a support with an inbuilt cushion which gives an upward compression of the plantar fascia. So as it says on the product here, you place this on the inside of the heel, mid part of the arch, and then simply wrap them round using small Velcro fastenings to position it in place. What this is doing is acting to give an upward compression and taking tension off of the plantar fascia. As the plantar fascia attaches to the heel, if it's under strain and tension, it tends to cause some irritation here and giving you the heel pain. So the product works by relieving pressure under here by giving some cushioning effect, taking pressure off the heel and reducing symptoms of plantar fasciitis. So once fastened, adjust the two Velcro fastenings for the desired amount of compression and upward lift. And then slip a sock over the top if you wish. It's thin and will fit inside most shoes without any problem. This is our plantar fasciitis night sock, often also called a Strasbourg sock. It's pulled on like a sock. This will be released, and it's pulled on like a sock, and then the top fastening is a simple wraparound Velcro fastening. It's comfortable and it's soft to wear. Now, how does it work? The night sock works by, through this pulley system here, we use that, and what we're doing, this is holding it in place, we're bringing and pulling the toes towards our knee, and this is putting a stretch on the plantar fascia. And physios and osteopaths agree that for many people, a long stretch, for example overnight, is very helpful in both reducing daytime pain and speeding up healing. The amount of tension is controlled through the simple pulley system with a Velcro fastening. Also has a couple of other features. Obviously, if you need to get up during the night, you're not going to be able to walk with your foot like this, so you simply reduce this off, and then it allows simple walking. There's also an anti-slip area here, which is pretty useful if you're walking to the bathroom at night. So the night sock is absolutely perfect for a long, prolonged stretch of the plantar fascia during the night. And then coupled with perhaps a daytime compression sock, we're offering total support of the plantar fascia, offering both pain relief and speeding up healing. So thank you for watching this video about this particularly painful condition, plantar fasciitis. Hopefully I've showed you some of the products I recommend to my patients to help treat and manage this painful condition. I'm often also asked about, is there anything else they can do as a patient themselves, and I often recommend ice. So after a long day on the foot, the heel and the plantar become painful, so I recommend ice. In order to find more about icing, go to the website and look at my blog about how to safely ice. And if you want to keep informed with more videos, don't forget to subscribe at the bottom.